are back in the zone, and today is World Spine and National Sports Day, and we've got with us Dr. Ehsan Jazini, who is with Virginia Spine Institute. He's a spinal orthopedist. Did I get that right?
You did.
Okay, good.
Gotcha.
Check. We're talking about injuries and just common injuries, and I think for all of us, even though we're probably all amateur athletes, just going up the stairs, coming down, carrying backpacks, carrying a kid, all of that can produce injuries.
The Peloton bike.
That too. And hopefully it doesn't end like it did in Sex and the City, but these are real.
Oh, I was talking about me I don't know nothing. Dr. Ehsan, could you please tell us what could happen, especially to somebody my age with treadmills, Peloton bikes, heavy bags, weights, all of that stuff?
Listen, injuries are super common. No matter what you're doing, you can injure yourself, right? So the key is prevention. And what I preach to my patients, and I've done over the past 3-4 years, is do more yoga, work more on my core before I hit the gym and do heavy weights to help prevent some of those injuries that you're describing.
Well, what does that do for my? All right, so work on my core.
Yeah, so it's like a tree. If you don't build a good foundation before you try to build out the limbs,
take care of the trunk before the limbs can.
Yeah. That's a good way to remember it.
Take care of the
It's
trunk
something that you
before
learn,
work on
I think, a little too old. When you hear about people talking about, I've got bad knees, and then they say, well, you got to fortify the quads. I've got a bad back. You got to fortify the core. We're looking at these pictures of these kids these days. I know that with technology, we're going to the iPads and computers, but yet still, this can't be good for your back, holding all this weight up. I know you have a backpack here. I don't know how heavy this is, but how is there a proper use of a backpack?
Yeah, so just to lift this up, I want you to feel it, right? This is about 10 pounds, right? A good rule of thumb for your child, you want it to be about 10% of the weight. So if your kid weighs about 80 pounds, it should be about 8 pounds, right? So one thing is the weight, how much load you're putting on your back. The other is how you wear it, right? You want to make sure that both straps are on, it's symmetrical, it's not causing muscle imbalance, right? I have a niece and nephew, 10 and 6, so you know, it's October. We're still pretty early into the school year. So this is the time to really make sure your kids are not putting too much weight into their backpacks. It's amazing how much it can add up. Laptop, textbooks, right?
So I grab my kids' bags every morning, like let dad carry this to the truck, to the car, because they have problems getting in the car where they're carrying breakfast or whatever. How unhealthy is this over the long term for my kids? I have a 14-year-old and a 12-year-old.
Yeah, we're living longer and longer, right? So the injury prevention starts at a young age, right? A lot of disc issues, there's some genetic component to it, but there's also how you use your body, right? So it runs in my family, disc issues, it runs in a lot of families. So it starts early, and prevention is the key.
Man, this make my knee hurt now.
This is why I remember when I was a kid with the roller backpack, like put it on wheels, because sometimes there's so many textbooks, it's almost...
Right.
I got a 30-pounder, a 1-year-old who's 30 pounds at home. And I was here with BioFreeze walking like this for a full... What works? Like, what over-the-counter remedies help? Because they say you got to squat if you pick something up. Don't lean forward. I get that, but I think for most of us, when we're in a rush, we're getting things done. That's not always the case. If we're home and we don't have you to call right on speed dial, what can we do, or what works at least to relieve the pain in the immediate?
For the initial inflammation, a BioFreeze, a lidocaine patch, something to calm the inflammation down. If you don't have any GI issues, Advil is totally okay. 3-4 days. You want to take it consistently for about 3-4 days for that anti-inflammatory effect to taking place. But you got to listen to your body. If the pain is not getting better, you want to seek help, right? I'm a spine surgeon at Virginia Spine Institute, now called VSI, and we have a multidisciplinary practice. It's not just surgeons, right? We have physiatry, we have physical therapy, we have a lot of different modalities like acupuncture, regenerative treatments where we can help you, right? So I would say do some of those remedies you just talked about in the initial 2-3 days, but if it's not getting better, you want to seek some help.
Gotcha.
Well,
I'm
I hope people are listening.
Well, look, these kids, if my kids are in your class, they're going to be unprepared because I'm not letting them break their back.
No, yeah. I mean, I think we have to have a big conversation about backpacks, especially because it's your whole school life, right? It's not.
I'm watching my son. He's 12 and he's walking like that. I'm like, no.
Yeah, with teenagers, another big topic is stress fractures, pars fractures.
Yeah.
Unfortunately, we see more and more of these overuse injuries, and it has to do with the fact that we're making our kids do one sport. We're trying to push them really hard, right? We want our kids to be really, really good, and we're not doing multimodal. When I was a kid, I played basketball and soccer and all sorts of
with swimming,
sports. But kids, their bones haven't developed yet. to the point where we can really have them go into the gym and do weightlifting. So we really got to pay attention to that because unfortunately we see a lot more of that, right?
Cool.
Very interesting
Thank you much.
conversation. Dr. Jazini, thank you so
Thank
much
you.
for stopping
Thanks for having
by.
me.
And
We're going to have a
absolutely.
conversation at my house tonight.
Definitely. All right, thank you so much.